Hi guys, this is Doc Kriz again, your online family doctor, making medicine easy for you to have a healthy life. Let's do another Q&A with Doc Kriz, okay? So again, I'll be posting videos on TikTok as well on YouTube to answer some of those questions that you ask or comment on our previous videos or reels or shorts or what you call it, and try to himay-himayin natin. Sige, nag-English Taglish na ako dito. What is the better way of explaining that comment, and at the same time, what's the answer that you want to derive it from? And we'll try to choose those interesting comments or questions and even try to dig in deep para lang din maintindihan ninyo. This is an interesting comment, and I think it's a comment. No? This is from Ina 6478. So sabi niya, yung doctor ko, ayaw niya ng generic. Branded daw dapat para effective. Again, I think I tackled this in the previous video na generic, every drug has a generic name. No? We have brand A, brand B. They fall within one generic name. Let's say, for example, amoxicillin. And then brand A and brand B, they're just marketed as toward different companies. But the effectivity of both drugs are the same. Now, merong discrepancy regarding sa comment ni Ma'am Ina kasi as mentioned, yung doctor daw niya, I'm not sure who's her doctor, but he or she prefers branded drugs. Now, every drug is branded. That depends on what do you delineate from branded drug or not. Now, branded, that will encompass kung ano ba to, mamahalin ba siya, high-end siya. Kung papansinin nyo, kung may mga different types of branded drugs, may drug name na or brand name na mas mahal, meron din yung brand name na mas affordable. Okay? Hindi ko sinasabing mura because medications are expensive. Okay? So there is one that is more expensive and there is one that is more affordable. Yung swak sa bulsa. Okay? Na kaya sa bulsa na mabili ng isang middle class Filipino. Diba? But the efficacy, both drugs share the same efficacy, bioavailability, and it can help treat your condition. Now, why is it na mas mahal yung isa? It's because probably there are a few factors. Brand A might be the innovator drug, the first drug in the market that was included, okay, that had a lot of research and had a lot of studies to prove that the drug or the parent drug is effective in treating certain diseases. So, malaki ang napool na pera to study that type of drug and to add more evidence to that drug. Okay? So that's why it's being trusted by a lot of studies and researches. Kung napapansin nyo, there are a lot of studies in a expensive drug. May research dito, research dyan. Siguro the research list would encompass around 10 types of researches or more, depending on siguro how big the pharmaceutical company created that drug. No? Tapos yung sumunod, that second brand only emerged after the patency expired. Meaning, may certain amount of years kasi bago makapag-produce pa ng similar type of drug ang isang gamot because there's an exclusivity period for the drug. Para lang din mabawi ng company yung nagastos nila para gawin or ibuuin or i-create yung drug na yon. Because they have that right. Now, at the end of the cycle na, after siguro 10 years, ganun, I'm not sure kung ano yung years of patency, magkakaroon na siya ng availability with other companies na sila magpo-produce or reproduce nung drug na yon. Ngayon buhol, mas cheaper sila because they have lesser materials, or let's say for example, the materials are taken similar to dun sa patent drug, but the costs are cut because there are less researches already. The researches of the first drug can follow over or carry over with the new drugs because they share the same bioavailability, meaning same drug yung laman ng gamot nila. They are just in different brand names. Okay? So the effectivity will still be the same. Yun lang, there are less studies conducted by the company compared to the first drug. Now, bakit siya mas mahal? Yun nga, lesser yung na-cost na ginamit para produce yun. Mas mahal, mas mahal yung isa kasi mas maraming research. Sorry, nalilito ako. Yung second drug, mas konti lang yung research na ginamit. But, they share the similar efficacy because they have the same type of drug. Now, kung ako yung doktor, masyadong mahaba, diba? Kung ako yung doktor, anong pipiliin ko ibigay sa pasyente? Well, I could choose either of the two. No? If let's say, for example, I see a patient that is simple ang kumbaga type of pneumonia, cough, colds, fever, either of the two I could provide. No? Let's say, for example, this type of drug can be prescribed. Let's say I chose brand A for the patient. Okay, let's say, for example, the patient, well, accepted the prescription. Okay, now, no problema doon. Next patient. Patient also had the similar features. Pneumonia again. I prescribe brand A. Pero at the same time, they ask, Doc, pwede bang mag-generic or something mas affordable? So if the patient requested this, well, yeah, there's other prescriptions or there are other brands that are readily available. I could offer another brand that can be more affordable for the patient because it's the option of the patient. So, it's common in private practice. No? Common in private practice. So, either of the two will do. And we're not pushing na, hindi, ito dapat. Okay? If there's a doctor that will say, hindi, ito dapat. That stems a lot of, kumbaga, syempre, you will try to question kung pinipilit niya. Because, in the Philippines, we advocate generic law and equal affordability of drugs. Kung mas gusto niya mas affordable, you prescribe the more affordable type of drug. The better thing there is kung nakikita mo naman, pero marami na siyang gamot na iniinom, polypharmacy, 5 to 6 drugs na tinitake niya, then you prescribe something expensive, pero mag-isip-isip ka, di ba? Look for another brand that is magkakasya sa bulsa niya na mabibilin niyo pa yung ibang mga gamot niya. Kasi let's say for example, hypertensive siya, tapos diabetic din siya. Mahal na yung gamot niya sa diabetes. Then your hypertension medication niya, look for something that can be both effective and affordable for the patient para hindi mabigat sa bulsa ng isang pasyente. But that's the harsh reality of private practice, diba? Kung private practice kasi talaga, you have to prescribe. No? Now, if in the setting of a government practice, as a government physician or in the government hospital, there's a rule or dictum there. It's always important or prudent that we prescribe generic drugs. So we don't advocate providing a brand name, okay, in the prescription. Para they will choose which is the more generic type or the more, pangit kasi nung definition the more affordable for the patient because they went to the government hospital para, makakuha ng affordable healthcare. So, hindi, in that strict sense, even the medication should be affordable. Okay, na kaya nilang mabili or ma-attain or ma-procure kahit hindi nga maglabas ng pera. Okay? So, medications, brands, generics, they fall differently whenever it's a government-issued practice, like in a government hospital, and private practice. So, it will depend, kung saan ka ba nagpapacheck up. In private practice, there are some doctors that would still ask, okay lang ba to? Or kung gusto mas prefer niyang generic, they humbly would say just yes, magkuhan na lang tayo. Let's look for something na more affordable sa'yo para mas kaya at swak sa bulsa mo. Para hindi ka naman mabigatan sa pambili ng mga gamot mo. Okay? So that is the right type, of prescribing and also giving care to your patients. Hindi yung nagpupush ka ng medication na sobrang mahal. Okay? And sa pa yan, syempre, if you're pushing too much medications, baka yung mga ibang medications are no longer necessary, okay, for the patient. There are certain aspects that whenever there are senior doctors in the past that they re-prescribe until such a point na hindi na nakikita na this type of medication should no longer be part of the treatment. Kasi normal naman na yung results. Or let's say, nag-stabilize na yung kanilang condition. So they can de-prescribe. Okay? This is especially true for elderlies. Kasi de-prescription is important to avoid polypharmacies. Okay? And that's another topic. Naligaw na naman ako. Pero that's important. De-prescription is important. Okay? So whenever you ask or whenever you go to your doctor, I hope your doctor is like this, no? I hope your doctor is like this. And he or she prescribes and ask, Doc, if this medication affordable? Because if, let's say for example, baka magastos, baka meron kayong mas mura or mas affordable na brand na pwede kong mabili, na pwede makatulong din mag-control ng blood pressure ko. It's a simple way of asking your doctor doing about that. It will help, okay? It will open better communications on getting affordable healthcare. Now, another strict consideration dyan, di ba meron na tayo yung GAMOT in PhilHealth? There are limitations there kasi there are only a few medications that are listed in the GAMOT in PhilHealth Yakap, diba? And that's free. Now, no, technically hindi siya free because there is a cap of 20,000 in a year. Pero you will just be relying on the list of medications. Pero kung nandun yung gamot na kailangan mo, that's good. You could get or avail that from the PhilHealth Yakap and from a GAMOT prescription from that PhilHealth accredited primary care hospital or clinic. Okay? Basta makuha mo yung prescription nila. You don't need to think about brands kapag ganong sitwasyon. In that way, that pharmacy will only provide you the accredited drugs under the PhilHealth GAMOT program. Okay? Hopefully, naintindihan nyo what's the difference within private practice prescriptions and general practice prescriptions, and also the PhilHealth Yakap prescription. Again, private practice prescription, you prescribe medication, you often provide brands, but if you think this brand or you experience this brand to be expensive, try to ask your doctor kung pwedeng palitan. There's no harm in asking, okay, there's no harm in trying. If your doctor does not want, well, I'm not sure why for your doctor. Pero for us, as doctors, like family doctors, we encourage that you ask if kailangan talagang to make it a more affordable, you can, okay, find another suitable brand for you. Okay, that is in our way of caring for you. Okay, in government, prescriptions that are issued by a government physician within, let's say, the outpatient department of Cagayan Valley Medical Center, most of the time, we don't write the brand name, it's more on the generic name, and you get it either in the Botika ng Bayan or the consignment. Kung wala talaga, it will be in an accredited partner, let's say a commercial pharmacy outside. But most of the time, you will be talking with the pharmacist kung ano yung mas affordable na brand for you. Okay? In the PhilHealth GAMOT app, okay, the GAMOT in the Yakap, you are only limited to the list of meds that are accredited by PhilHealth. But if your medications are within that list, that's good. And that is a deal breaker because you are entitled for 20,000 pesos worth of medication. Okay, as long as your medications are there, you can be issued that medication for free or deducted from your 20,000 yearly, okay, allowance for your maintenance medication. Okay, hopefully malinaw ito. And I guess, again, maganda yung discussion about generic, branded, PhilHealth Yakap prescriptions and prescriptions in general. It's important na maintindihan nyo ito as patients who are being prescribed medications and know your rights. Okay? You have the right to ask. You have the right to request kung kailangan mas affordable yung type of medication for you. Just tell your doctor para uh, mahulma to a more affordable, cost-effective, and syempre, budget-friendly for you, okay, as the patient. Lalo na kung marami kang gamot. So, if you like these types of video, please give me a heart, thumbs up. Ano ba yung mga reactions in a type of video? Okay? If you do appreciate these types of video, do share your comments down below. And again, I really like these types of conversations kasi magandang mapahulma natin yung thoughts natin about healthcare because there are a lot of misinformations online. Okay? And misinformations are now the new pandemic because of too much info that is being fed by other health gurus that are not relevant in terms of health. Okay? And please follow a lot of those health-related doctors that are priming, okay, in promoting better healthcare, especially in the space of social media. And again, this is Doc Kriz, your online family doctor, making medicine easy for you to have a healthy life. Good evening.